termed the pleural space. There are approximately 2,000 to 3,000 new cases of primary cancers of the pleura or malignant pleural mesothelioma that are diagnosed each year in the United States. We know that remote exposure to asbestos is a risk factor for developing mesothelioma. Tumors of the pleura can also be and are most often secondary to metastases from cancer involving distant parts of the body, such as colon, prostate, and ovary. While primary pleural malignancies, and this is defined as tumors that arise from the pleura itself, are fairly uncommon. Therefore, physicians tend to have a difficult time making the initial diagnosis of mesothelioma. We continue to learn more about malignant pleural mesothelioma with respect to the diagnoses, management, and possible treatment options. We now know that for a subgroup of patients, multimodality therapy, or the combined use of chemotherapy, radiation, and surgery, is associated with better outcomes than the use of any single one of those treatment options alone. Therefore, survival of our patients with mesothelioma is beginning to improve. Up to 80% of cases of mesothelioma are associated with asbestos exposure. The remaining cases can be related to family contact as well as non-asbestos type causes. People most often are diagnosed with mesothelioma in their 50s to 70s, and males are affected more often than females. It can be difficult to differentiate a malignant pleural mesothelioma from a different type of cancer that we call metastatic adenocarcinoma. These are two completely different types of cancer with vastly different treatment options. As I mentioned before, pleural tumors are more frequently metastatic cancers than mesothelioma, and so we utilize many different tests to accurately make that distinction. It is crucial that we have enough tissue sample or a large enough biopsy specimen to adequately characterize not only the tumor as a mesothelioma, but also to distinguish which